Hi, I'm Dr. Matthew Rowe, upper cervical chiropractor reporting for Natural News University. And today we're here to talk about managing multiple sclerosis, or MS, through upper cervical care. Research has shown that multiple sclerosis is affecting over 250,000 people in the United States. It affects women twice as often as men, and it's more common in colder or northern climate zones. So this is a pretty devastating neurological disorder. Some of the symptoms that are related to MS are numbness and tingling in the hands and the extremities, pain, vision loss, balance loss, and many, many more. Today we're here to talk about why upper cervical misalignments could be a contributing factor to MS. Research has shown that there's a subgroup of multiple sclerosis sufferers that have actually suffered a trauma prior to the onset of symptoms. Now, a trauma, whether it be a car accident, a slip or fall, a sports injury, a work-related injury, can cause spinal misalignments in the upper neck. These spinal misalignments over time cause a chain reaction in the body. Now, this chain reaction can trigger a whole host of problems, including MS. So if we look at our diagram here, what we're looking at is we're looking at the head that sits on these top two bones. Now, these top two bones control the head position, and they're called the atlas, which is the first one, and the axis. We've got the atlas here in yellow, and then the axis. There's a part of our brainstem that comes down through the base of our skull, passes through these top two bones, and it becomes the spinal cord. Now, traumas, like I talked about earlier, whether it be a car accident or slip or fall, can actually cause these top bones to move out of their normal position. Now, these misalignments, or what we call subluxations, can actually put pressure on the brainstem area via the dentate ligaments, and this can cause distortion. It can compress our spinal cord, and it can prevent the nerve supply from our brain flowing to our body. One particular thing that they've been finding with MS patients is that there's an artery that runs up the side of the neck. It's called the vertebral artery. Comes up through the atlas. There's a small hole on each side, and then it supplies our brain with blood and oxygen. They're finding that when these top bones misalign or subluxate, it can actually distort or kink this artery, preventing the proper amount of oxygen and blood supply to the brain. It has been hypothesized that this kinking of that artery is actually what is contributing to multiple sclerosis. There's thousands of patients across the globe being helped by upper cervical doctors with MS. There's a lot of research being done, so check back and we'll present that research as it becomes available. Thank you.